Hello, everyone. It's a pleasure for me to be here this evening to speak to you about interprofessional collaboration in nursing. I am Professor Selvatitis Chaco, the Dean of the College of Nursing, and I'm really happy that this concept of interprofessional collaboration in nursing is introduced to all the first years of various professionals who have joined the Gulf Medical University. And my mandate today is to speak to you about the role of a nurse in interprofessional collaboration. There are two objectives that are mainly that I am interested to address to. That is for each one of you to appreciate the roles of a professional nurse, the expanded role of a nurses, and the areas of specialties a nurse could work. And the most important area is that you comprehend the role a nurse plays in either in an emergency or acute care, hospital, or primary home care. Now, what is nursing? Nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. This year is very special to nursing. Why? Because 2020 is commemorated by the WHO as the International Year of the Nurse and the Midwife. And this year, during the International Nurses Day, the theme was Nurses, a Voice to Lead, Nursing the World to Health. We were supposed to celebrate it in a big way, but as you are aware, at the dawn of this new year, we were struck with pandemic. But I would say that the nurses have celebrated this year much more than what a normal celebration would be by being the frontline workers in combating COVID-19. So WHO actually commemorating this year as the nurse and the midwife has actually, set these posters out in relation to the International Year of the Nurse and the Midwife. Now let me just come to the first objective of role of professional nurse. All of you would have heard of a nurse being a care provider in a hospital or a multiple setting. Now there are other roles that she plays as an educator, teaching young ones, or also teaching junior nurses and being 24 hours with the patient. She's an advocate between the patient and the family and other healthcare professionals. She's a manager who manages the work, and of course being a collaborator. Today we're going to talk about the collaborative role that she plays, and a leader and a researcher. Now let me just introduce you to some of the expanded roles that the nurse works. Now I'm sure many of the nurses work as general nurses, but you could be a trauma care nurse, a cardiac nurse, an ambulatory care nurse, a burn care nurse, a breast care nurse, a rehabilitation nurse, an occupational health nurse, or a quality control nurse. This is just a glimpse of what she can be. Apart from that, she could also be a case manager, policy maker. When I say policy maker, she can sit with others on the policy making table where they would decide on the standards of care of a patient, also nurse-patient ratio and so on. Or she can be a nurse anesthetist, an administrator, a researcher, an educator. There are areas that a nurse has ventured on today. If you would like to be always traveling on the flight, you could be a flight nurse, areas like nurse epidemiologist and military nurses. So, and apart also they have moved on to disaster nursing. If you're a good communicator, you could be a tele nurse where you could do assessments for them or even give health education. And if you would like to work in long term, you would be a hospice nurse. And if you are an inquisitive nurse, you could be a forensic nurse, a public health nurse, or even work with people in jail as a prison nurse. These are all just glimpses of the expanded roles of nurses. Now, let me just introduce you briefly to some of the specialties that a nurse could be involved in. If you are quick in reasoning and quick in critical thinking, you could be a critical care nurse who could work with people of acute care. If you are a person who are very good with your skills with computers, you could be an informatic nurse. If you are good in communication and advocate, you could be a nurse advocate. You could be a stoma nurse. And there are also nurse practitioners which are developed mostly in the Western countries. You would see that if there are no doctors, there are nurse practitioners who also even diagnose and prescribe. Now, the other specialty areas are psychiatric nursing, where a nurse, would like to work with mentally ill people, a travel nurse, a geriatric nursing has come in a long way with working with older people, an oncology nurse, pain management nurse, neonatal nurse, nurse midwife, and dialysis nurse. So even if you like to work with children, you can work with children as well. So these are some of the specialty areas that a nurse is involved in. Now, where does she work? Of course, mostly in the hospitals, but she could also work with skilled nursing facility in Army, Navy, Air Force, outpatient settings, clinics, insurance companies. You know, these days, nurses are much wanted for insurance companies because they are very good in their assessment skills, and that's what the insurance companies are looking for when they assess their people who are applying for insurance. Government, community health, schools, universities, space, specialty clinics and hospital, and there's no place that a nurse has not ventured into working. Now, just a word on the nursing statistics. WHO has shown that this year in 2020 that the world is short of 6 million nurses, and they're expecting by 2030 for all the countries, if they would like to achieve sustainable development goal 3 of health and well-being of humanity, they would need another additional 9 million nurses. So I'm just trying to say that we will never ever run short of work or job, and we always will be wanted all over the world. Now let me come to my second objective today in addressing the interprofessional collaborative role of a nurse. I'm sure all these professionals are seated among you. There are people who are becoming doctors. Now you would say we are doctors and we lead. A dentist might say when you want to look at the mouth, you need to have me. Whereas a pharmacist would say these to be a group of people. If they want to know about the difference between two drugs like benzodiazepine or barbiturate, I need to be there. And what is a nurse saying? Excuse me, I'm a nurse and actually I work directly with patients and I'm more important. All of them are important, but they need to be collaboration, and that's what we're looking at. That is why in WHO in 2010 brought this definition that it's no longer enough for healthcare workers to be professionals, but in the current global climate, healthcare workers need to be interprofessional. Okay, look at this picture. It clearly speaks a lot actually. You know, you could be tall, you could be short, you could be anything, but when you're playing in a team, each one is equally important. And that is why this definition, I'm sure you would have heard about interprofessional education, many of them speaking to you, that it is between two or more professionals, that is learning from, with and about each other to improve the collaboration and the quality of care. Now, when we look at the collaborative role of a nurse in a wheel or a machine, you would see that she's prominently placed. I'm not saying that others are not. Each are equally important, and that's what we are going to look at, especially on nursing today. Before I proceed on, I'm sure you would have been spoken about the core competencies that you will gain out of interprofessional education. And I just would like to reiterate that today again. Values and ethics, mutual respect and shared values about each other, where you learn not only your role, but you also learn the roles of others and responsibilities of each other by being in the part of interprofessional education. And then you communicate in a manner that will support each other, so your communication skills improve and you work as a team and teamwork by building relationship and values and principles. So being a patient-centered care that we provide, you are in this exposure area now on these 4 core values that were spoken about, and you immerse yourself into it as you develop over the next 4 or 5 years, and then you become competent in these 4 or 5 years, so that we provide quality care to the patient. Now, let me just take you through briefly how nurses are enhancing interprofessional collaboration in today's healthcare marketplace. As I said, first, I would like to address the emergency acute care. You can see that here a patient is being wheeled into the emergency care, and the doctor and the nurse are already communicating as they wheel in, and also others are involved in. The similar situation happens in operation theatre or intensive care. It's a very stressful acute care area where their respect and teamwork is important. Now let me take you to this slide. I do not want you to think it's a very busy slide, but just to make you understand. Imagine a person comes with a minor head injury. He's had a bicycle accident. He's a drunkard. He's uncooperative. He's got an injury on the forehead. He's got a bruised right arm with pain, confused on communication. Okay. He's been wheeled into the ER and he's been transported and handed over. Only the patient, there's nobody else with him. He's confused, and as I said, he's drunkard as well. And wherever I have highlighted, that is an emergency nurse. And she, as well as he or he, with the medical doctor examining and deciding on further examination, where they think that the physio needs to be involved to look at, assess the arms and so on. And they are deciding on further diagnostic, where they are calling in the medical laboratory technician and the imaging for blood test and X-ray of the right arm and MRI scan of the head. And they understand there's not much problem with the patient, and they are deciding to manage with painkiller, exercise, or of the arms, as well as antibiotics. So apart from all the others, you have to get in the pharmacist for the drugs and the physio for exercise. Now please understand that he's a drunkard and uncooperative. So they are deciding before they're sending him home, there need to be a socio-cultural status assessment and a psychological counseling that is provided. So we're calling in the psychologist and the social worker. Now, what is the IPE focus here? He's here, he's not able to communicate properly, he's confused, he's drunk and uncooperative. There needs to be good communication among all the workers, and a common concept of management is important. And you can see the role of a nurse with a physician, physio, medical laboratory technician, imaging, pharmacy, clinical psychologist, and social worker. So what is the lesson that we learned? You can see the nurse having good communication and handover, and the concept of management, which will reduce the error, and they learn to respect each other with and also have value about each other's role. The second scenario that I would like to take you through is the hospital where a diabetes mellitus patient is there. Okay, you can see that she's about a 30-year-old lady who is obese, and you can see the nurse collecting history from the patient. She's a single mother who's a caretaker in a school, overweight. She doesn't like to go to the healthcare because of the fear that everybody will ask her to reduce weight. She knows the risk, tired of trying in spite of not having much time for herself. She broke her ankle, requires surgery. Her sugar level is high and surgery is postponed. She is angry and upset, and she says no because she has no time and no money. Now, when we look at the diabetic care, there are different aspects to it. I will not address that, but just look at the first part. The delivery system is designed on interprofessional team. So there's a person with diabetes, there's a physician, nurse, registered dietitian, pharmacist, physiotherapist, psychologist needs to come because she's upset and angry, and she's going to go into the community living with diabetes. So we need to also involve the primary care providers. If you look at this wheel of diabetic care of healthcare team members, the doctor or the nurse practitioner, the nurse, the dietitian, and the pharmacist surround the patient. And apart from that, the physical therapist, the food care specialist, and mental health person for psychological support, family and friends, dentist and optometrist, and a whole lot of team is involved. So what have we learned? The key learning from this scenario is that all these people, you need to know the importance of interprofessional team in diabetic care. I'm just taking an example of diabetes. You can see that all of them are seated together and they're all comfortable with each other, complementing each other in a non-threatening environment, discussing the patient and coming together in deciding. So I'd like to take you through a video in which I just want to show you how a teamwork happens.
The trust and cooperation just wasn't there on the unit, not even any accountability. It got to the point where I didn't even want to come to work anymore.
Things weren't getting done, and the communication was bordering on dysfunctional. Worst of all, we were making errors. It felt like we were letting the patients and their families down.
It took us a while to figure it out, but when we did, we realized what we had been missing. We finally started to work as a team.
So what made us wake up and start thinking and behaving as a team? It was a lot of things.
They have to repeat the colonoscopy on David's tomorrow. He wasn't prepped properly.
Certainly patient care was a factor, as was the bottom line.
We're down 2 staff again. We're going to need a floater and one of the travelers.
Turnover and poor morale are costly. And after reading a study that clearly identified teamwork and communication as major variables in error prevention, we began to look at it as a risk management issue.
It's really a national issue. According to previous studies, 70 to 80% of medical errors are related to interpersonal interaction. Who can afford not to have teamwork? The Joint Commission on Accreditation of Healthcare Organizations recognizes this. It states, Teamwork is essential for optimizing quality and safety in the care of hospitalized patients. In fact, the Joint Commission now requires evidence of interdisciplinary collaboration in hospitals, nursing homes, and clinics as part of its accreditation review process.
On our Med-Surg unit, the textbook notion of a team sitting around some table leisurely discussing their goals and work assignments wasn't our reality.
Hey, can you check on Mr. Johnson right now?
Yeah, but I gotta call Dr. Miller ASAP. Where I work, we hit the floor running and can barely catch our breath. I may not even know who my team is until I come on to my shift. I used to assume that this team building stuff didn't apply to us. But over time, I've seen that there are ways to foster teamwork, even in our environment. We all know that just because people work in a group, that doesn't mean that they work as a team.
Could you help me with the patient in room 7?
Does it look like I'm not busy here?
If we don't get him ready for transfer soon, we'll be in trouble.
I'm going on a break, Amy, right after I finish this note.
With a team, there are 3 distinguishing characteristics. A culture of trust and collaboration, a commitment to a common goal, and mutual accountability.
So you saw this in this video that the most important thing is interprofessional team member acknowledging. So I just want you to always be an interprofessional team member who would try and work and achieve the best in the providing quality care. The third aspect that I was trying to talk about is the primary care with a geriatric patient. Nowadays you know that people live longer and geriatric care is becoming very important. Okay, now here look at this man. He's about 81 years old and who's in and out of hospital for a variety of health conditions, has heart disease, stroke, renal failure, has had a joint replacement. I'm sure in your own homes you would have your grandparents or other relatives who could be in this situation, walking with the walker, and he's got a wife who's 78-year-old and she is not going to be able to take care of him. He's got, urinary incontinence, so he's got a urinary catheter. He's been discharged from home, from the hospital with medications and needs home care, and the nurse practitioner and the social worker is going to follow him up at home. When we talk about the elderly care, the team that needs to be involved is large. Okay, it's a huge team approach when the patient is there, from the physician, the nurse, the caregiver, the family, the psychologist, certified nurse assistant who would come and visit him every day and provide care, dental hygienist, pharmacist, physician assistants, occupational physiotherapist, social worker, dietitian. A whole lot of people are involved in geriatric care. Now, what I'm trying to bring in is this patient with the family is going to keep going in and out of the hospital many times. So there's a bridging the gap between the hospital and the home. So the nurse and the social worker, nurse practitioner, keep monitoring this patient at home, and whenever required, calls the paramedic, emergency physician and the hospitalist and decide when they need hospital care and when they need to. And that is navigated by the nurse navigator. And the mobile nurse visits the patients at home and the pharmacists are involved. So it's a kind of a circle of involvement when we look after geriatric patients. So what I'm trying to bring in today is that the role of a nurse in the interprofessional continuum of care. We looked at emergency, okay, where the ER physician, registered nurse, X-ray technician, pharmacist are involved, the nurse is there. And in a primary care visit also, the nurse and the physicians are there. And in the continuum of care at home also, with the physical therapist, the home care nurse is involved. So ultimately, I'd like to bring in the benefits of the interprofessional care. All through we saw the communication is very important, and which increases the efficiency of each of our work and reduces errors. And that improves the morale of all of us. And it fosters creativity, better problem solving, networking, better clinical outcome, cost effective, safety is paramount, and strengthen professional identity. And we become good friends, continue to work on in this profession that we are called for. So the last word that I would like to leave with each of you is hold hands with each other from the very beginning and appreciate each other, compliment each other, so that we all would do the very best for the call that we are called for to provide good care to our patients. I hope I have addressed the mandate of mine today, and I wish you all the very best as you continue to learn and especially work as interprofessional collaborators. Thank you very much.